Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Cushing syndrome, we are looking at the diagnosis and some tests. So there are two steps in diagnosing them. So first is a test to detect the hypercortisolism. So detect hypercortisolism. So detect the hypercortisolism. So this is by you do a midnight salivary or serum cortisol. So it is midnight salivary or serum cortisol. So it is a highly sensitive test. It is highly sensitive. And the presence of cortisol in the saliva or the serum at midnight, it signifies the loss of the diurnal variation of the cortisol. So if it is present in the saliva or if it is present in the serum, so at midnight if it is present, this signifies a loss of diurnal variation of cortisol. This signifies the diurnal variation, and this is of the cortisol. The next test will be a 24-hour urinary free cortisol excretion. So 24-hour urinary free cortisol excretion. So this is increased 3 times the normal value. If it is positive, it will increase 3 times. Then comes the overnight dexamethasone suppression test. Dexamethasone suppression test. So here there is a DST, that is the plasma cortisol, that is the plasma cortisol being greater than 1.8 microgram per dl, and this will be at 8 am after overnight exposure to the dexamethasone. So this is 8 am after the overnight exposure, and this will be to the dexamethasone. That is, there is 1 milligram given at about 11 pm. Next we look at the low dose DST. Low dose DST, it is a very highly specific, this is very important, highly specific test, and the plasma cortisol here is greater than 1.8. So the plasma cortisol, so there is a presence of plasma cortisol, this is going to be greater than 1.8, and this is microgram per dl, and this will be nothing but at 8 am. And it will be 8 am on the third day. So it will be 8 am on the third day, and after giving 0.5 mg dexamethasone every 6 hours for 2 days. So this will be after giving 0.5 mg dexamethasone. So after giving 0.5 mg dexamethasone every 6 hours for 2 days. Next we move on to the test to rule out the pseudo Cushing syndrome. Next is the test to rule out pseudo Cushing syndrome. So here what we do is a low dose DST. There's a low dose of DST and also the CRH stimulations test. So what is happening here? The plasma cortisol level are increased in true Cushing's. So the plasma cortisol is increased in terms of true Cushing's, but remain unaffected in the pseudo Cushing's. So this is a positive finding that in true Cushing's the plasma cortisol increases, in pseudo it is not affected. And the DEXA induced negative feedback is overcome by the CRHN. So the DEXA induced negative feedback, this is overcome by the CRH, and this is in terms of the true Cushing's. To learn and grow daily like this, please do subscribe.